they'll go back through and re-experience earlier life memories, and they will be able to experience it from a place of empathy, not only for themselves, but from others, and kind of a detached empathy, and being able to see this as almost a third party, even though they were there. You're essentially having this, what they call a life review. They also call it 10 years of psychotherapy in a night. And so, we have over the last couple of years been able to do this first in human, kind of full neurobiological, clinical, neurocognitive evaluation of what Ibogaine is doing. In this case, in special operations, special forces individuals, former Navy SEALs, former Army Rangers, that kind of crew of folks, and look at the pre-post changes that that they're experiencing, to be able to totally quantitate all of that. So then we see these folks after, and I'll tell you, we haven't fully analyzed the data yet, but I'll tell you that from what my folks are telling me, it's pretty dramatic. They come back and say that they've forgiven themselves, which is huge, right? And part of that is being able to see themselves in a different light and having empathy finally for themselves, and being able to kind of have that experience of forgiving. What I think is that if you rid yourself of all of those preconceived notions of what it is and isn't, and the counterculture movement, all that stuff that neither of us were ever involved in, neither of us are ever partake in, is kind of straight scientists looking at this, right? If you can kind of rid yourself of all those sociocultural constructions and then re-examine this, if we just discovered these today, we would say that these sorts of drugs are a huge breakthrough in psychiatry, because they allow for us to do a lot of the sorts of things we've been thinking about with SSRIs, with psychotherapy, but kind of combined, right? Psychotherapy plus drugs in a substance that kind of allows you to re-examine